for coming live with me. I've been trying to make sure that I fix everything and it's working properly. I'm now live on TikTok, I'm live on YouTube, I'm live on Instagram, and I'm live on Facebook. And I'm facing the camera of YouTube just in case. Thank you for joining me in this live broadcast. It's one of the most important broadcasts I'm going to shoot in this year 2025. So if you're live with me, please make a very good, important step of sharing this live broadcast. It's very, 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 very important. And I also say it's good to do that. The title is The Human Cost. The human cost. I'm talking about winning the battles and losing the war. How symptoms and management of symptoms is destroying our health. That's what I will be talking about today in the next 40 minutes before I dash out for my regular job. Imagine your house is on fire and you call the fire brigade and they arrive. But instead of putting out the fire or the flames, they will now hand you a fan and they will say, take this fan so that it will help you to breathe better through the smoke. Or maybe they hand you an oxygen and they tell you to remain in the rubbles, but use the oxygen so that you can breathe better. We are plowed, we pay, then we rebuild the sofa, repaint the wall, and congratulate ourselves. But unfortunately, a year later, we'll now see that the roof of the house is coming down. That is what is going on now in modern healthcare. Very busy, very heroic, well-meaning people trained to treat what's in front of them, the symptoms, why the root causes quietly burn the house down. I visit the hospital to see patients and I look around. I tell you, it doesn't look normal to me. It's not normal for young people and children to be bedridden in the hospital. It has now become a commonplace. Every day we see people begging for money on social media for medical intervention. They have exhausted all that they saved through their work life, all that they worked for. They have spent it on their malady, on their disease. They have sold all their investments. They have sold all their properties, all their lands. They have even borrowed money from friends and well-wishers, even from enemies. And now they are coming on the public, on Facebook, to beg for more money. Well, it's okay to support the sick, but I used to ask a pertinent question, and that question is, where are you putting the money? Are you addressing the symptoms or the root cause? This is a very simple question, but it's a pertinent question I ask anybody who cares to really understand. Because I watched closely, for instance, when our beloved Mr. Ibu was begging for support. God bless his soul as he is late now. But how many more people do we want to lose because we have become disease managers, symptom managers, and not address the root cause? We focus on reducing the markers, the numbers on disease. Your BP is high, so let's get the numbers down. Your blood sugar is high, so let's get the numbers down. But we do nothing to address the root cause. Well, we live in an era of dazzling medical technology. There are scanners that can even see inside of you. There are drugs that can change numbers overnight. You have surgeries that feels like science fiction. I shared one yesterday of how somebody is now living without a heart, but with machine. That is the science that we live in. But why is it that yet people are sicker than ever? Diabetes, heart disease, cancer, depression, autoimmune conditions is exploding. Medical bills are the leading cause of bankruptcy in many, many, many countries. And families are sinking in debt. Patients are dying slowly, painfully, through an expensive death. Why? Because we confuse managing symptoms with healing the person. Now, symptom management has a place. Nobody wants to suffer needlessly. So if you break a leg, it's okay to take a pain relief. Of course, it's okay just to mitigate the pain for the in time or for the time being. If you cannot breathe, it's okay to have oxygen fixed on you because oxygen is life. But when treating symptom now becomes the entire strategy, when every chronic condition is now met with a prescription and no curiosity about how it started, we will win the battle, but we will lose the war against disease. I respect and honor William Osler. I call him the father of modern medicine. He once said that the good physician treats the disease, but the great physician treats the patient who has the disease. Well, that is the reason why I say there are no incurable diseases, but there are many, many incurable people. Why? Because they refuse to adjust their lifestyle. Today, we rarely ask about the patient. I'm now addressing our doctors. We are obsessed about the numbers. When we read the data of patients, we focus on their blood pressure markers. We focus on their glucose reading. We judge them by their liver and kidney function, but never do we consider the circumstances that is surrounding these patients. Never do we consider the responsibilities. Never do we consider their lifestyle. Never do we consider their work. Never do we consider their diet. Never do we consider these things because we don't know that these things are important cofactors of health, and we cannot heal the patient until we address these cofactors. I'm giving you a very few pictures to elucidate my point. For instance, you have a garden. You can keep mowing the weeds in the garden every week. But again, you can think twice and think, how do I uproot these weeds and fix the soil permanently? Another example, if you have a leaky roof, I've had one before in the past, you can keep mopping the puddle on the floor, the water that is dripping from the ceiling on the floor without repairing the hole. But eventually, one day, the ceiling will cave in if you do not address the ceiling and the zinc to stop the leaking. Another instance I can give is that of war, when you begin to celebrate victories in small battles, like lowering the blood pressure reading. My blood pressure was 140, now it's 130, I'm happy. Like silencing a cough. I used to have cough. I took an antibiotic, I'm now okay. Like shrinking a tumor temporarily, or maybe using surgery to cut it off without asking, why did the tumor come in the first place? But the enemy keeps advancing. The disease keeps advancing. The malady keeps growing in its root. And eventually, we now lose the war. The war. The war. Let me take you into this clinic. You'll recognize these stories. I have the first case here. Somebody who's probably having high blood pressure. I call him Mr. B, age 52. He comes in with blood pressure of 160/100. And now the doctor begins to prescribe medication. Now, 2 months later, the blood pressure is down, 130/80. We are now successful. But the root causes could be poor sleep, could be stressed life, could be processed foods, could be insulin resistance, which is a stronger marker in most of the chronic diseases. But none of these things are addressed. So very soon, few years later, a second pill is added. Then a third pill is added. Then cholesterol drugs are added. Then the person becomes pre-diabetic. We have controlled the markers, but we have ignored the fire. The man looks stable, but beneath the surface, his arteries are still hardening. His metabolism is still collapsing. He has won the battle, but he has lost the war. I give another second case of the abuse and overuse of antacids, especially when you have acid reflux. And I call him Mrs. C, age 38, has burning in her chest. She's been given probably proton pump inhibitor like omeprazole or acid blockers, but the pain vanishes immediately you administer this. But 6 months later, while she's still on those proton pump inhibitors, or a year later, she still can't survive without them. The thing keeps burning. But what is it that we miss there? It could be H. pylori. It could be infection. It could be poor eating habits, especially eating late in the night, drinking water with your meals, causing digestion to be more delayed. Improper food combination when you eat foods that's not meant to go together, or food intolerances, or even stress when you are stressed and you are eating while you are stressed. But meanwhile, long-term acid suppression is now depleting her nutrients, her vitamin B12 and magnesium, and that is raising her infection risk because it's reducing her immunity. But we have silenced the symptom with proton pump inhibitor. We have ignored the voice of the body, and we continue to complicate her health until she now develops cancer or diverticulosis. I take another case, which is very, very common. That is urinary tract infections, which often people are given antibiotics to use. A young woman with recurring UTI, and each time she goes for a course of an antibiotic, the real culprits sometimes could be vaginal microbiome balance, and sometimes it could be hydration, sometimes it could be hygiene. She's not taking care of herself properly, but she's given an antibiotics. Sometimes it could be hormonal changes because she's eating wrong, so it's creating problems. But repeated antibiotics continue to destroy her gut, the gut bacteria, setting her up for digestive trouble, for deranged immunity, because I have said it often and on. The gut is the seat of immunity. So anything that alters your gut microbiome will derange your immunity, create yeast infection, and even cancer. Listen to me. In my 17 years of practice, I have noted that 90% of all cases of cancer that came to my deep dive session had a history of abuse and overuse of antibiotics. Now, it's like patching the same tire with the tape every week instead of you going to the road to find where the nail that punctures the tire is. I'll cite another simple case of chronic pain because we are so used to painkillers that if you have a simple headache that might be as a result of deficiency in sleep, you will go and take a painkiller. I sample a man that has chronic back pain and is given opioid, a painkiller. And for a while, when you take the painkiller, you can walk. But over time, tolerance begins to build up. You will now need higher doses, like somebody who is an alcoholic. Over time, one bottle will not be enough. If you're a cigarette smoker, over time, one stick will not be enough. Why? Because tolerance is building up. You now need higher doses, and then you become dependent. You become an addict. And nobody checked this man's posture. Nobody checked his core strength. Nobody checked his inflammatory diet. Nobody checked his stress load. And nobody explored natural rehabilitation. Now, that man becomes another casualty in the opioid epidemic, in the painkiller epidemic. A patient who asked for relief and was handed an addiction, handed dependency on painkillers, which will eventually knock out his gut integrity, poison his liver, and ultimately take his life, like he did to my mother. I cite another simple case of somebody who has type 2 diabetes. I call him a middle-aged woman with rising blood sugar. Now she starts with metformin. Over time, she's now given sulfonylurea, or maybe she's now put on insulin. But nobody addressed the refined carbs in her diet. Nobody explained the insulin resistance. Nobody supported her through lifestyle changes. For the last month, a 37-year-old diabetic patient came to me in my consultation and told me that for 7 years of managing diabetes, that nobody advised her on what to eat. She's been visiting the hospital, buying medication, metformin, amlodipine, glucophage, and what have you, insulin for 7 years, but nobody, no doctor, no nurse, no dietitian ever explained to her that diabetes is mostly a lifestyle disease. So year after year, her meds increased, her waistline grows, complications arrive, nerve damage, eye problem, kidney strain. Sometimes you could now have wounds in the leg that won't heal, they become gangrenous. And we kept the glucose numbers in range while her life was quietly dismantled. And it's happening every day. I cite another case of somebody who is mentally deranged. He has depression. A patient comes into my deep dive section feeling so hopeless, and within minutes, what happens? An antidepressant is prescribed. Sometimes necessary, yes, but often nobody checks this woman's sleep patterns. Nobody thinks of his thyroid function. Nobody looks, does he have enough vitamin D? What is his social isolation like? Does he have a trauma in her life? Nobody asks those questions. So the drug blunts the pain, but the root remains tangled. And months later, that same patient is still suffering, sometimes on 2 or 3 more psychiatric medications. I will give you a very short vignette, and I talk about the markers versus the people. For instance, Mr. A gets a cholesterol test. His HDL is high. Statins are prescribed. But later, his liver enzymes will continue to rise. So they put the person through more tests. And notice again, there's more anxiety, more labels of what the person is suffering from. So the man is now treated as a bundle of numbers. His waistline, his stress, his food choices, his sleep is ignored. And he's a patient of matters, not a patient of medicine. Why did this healthcare system that we are building, why are we doing it this way? Why does medicine fall into this trap? First, I say it's as a result of training. Most of us as doctors are not trained to identify and treat disease patterns quickly. And that's essential, especially in emergencies, but it's so disastrous for chronic illness. The second point is time. Time. Do you give enough time for consultations? It's very fast to prescribe than to explore diet, explore sleep, explore trauma, toxins, and look at other lifestyle adjustments that the patient can make. Again, it's incentive. What some doctors might get as a result of prescribing medication. System often pays more for procedures and prescription than they pay for prevention. I mean, a doctor won't sell, the pharmacist won't sell if you don't buy medication. Another challenge we have is fear. Defensive medicine. Doctors order tests and treatments just to avoid lawsuits, so they're afraid what the patient will do. Another challenge we have is expectation. There are some patients themselves, sometimes they continue to demand quick fixes because when they visit a doctor, they say they'll have the headache. They were expecting the doctor to give a medication, even when the doctor will want to prescribe, go and sleep. So a pill now begins to feel powerful, and lifestyle changes begin to be swept under the carpet. Another challenge we have is fragmentation. We now begin to have specialists that treat organs. Person that treats liver is different from the person that treats kidney, and the cardiologist will begin to manage your heart. The endocrinologist will manage your hormones. The gastroenterologist will manage your gut. But the root cause of this disease might weave through all these things together. And that is the biggest challenge that we have in the problem. Why I said it is the human cost. What is the cost? The financial ruin. Families are now selling homes just to pay for endless treatments. Polypharmacy. Patients are now on 5 remedies or 5 drugs at the same time, or even more. Sometimes some people are taking 10 medications each at every point in time, adding on top of their side effects. When I talk about dependency, especially when you are on opioids or benzodiazepines or antidepressants, these things are taken for years without addressing the root cause. And tragically, this begins to shorten the lives of the people. People die surrounded by pills in the bottles. Having won 1,000 small battles against the numbers, against the BP that is high, bring it low. The blood glucose that is high, bring it low. The liver markers that are going one ton, you bring it, you calm them down. But you have lost the war of health. So what can we do? What can we do to this? That's why I want to always bring the message of hope, because I know that there is hope. The reason why I come is because I know there is hope. And that's why I talk about addressing the root cause. You that is the listener, you are not powerless. I'm going to share with you just a few steps. And that step is number one. At your next appointment, please ask the doctor, why do you think this started? Well, I'm not expecting you as a patient to become a doctor, no. What I'm saying, ask the question, doctor, this is my headache. Why do you think the headache started? So that it will now inspire the doctor to probe deeper, ask searching questions that can begin to reveal the root cause. Ask the doctor, what is the plan to fix this cause? Not just to suppress the symptom, because you are addressing the root cause when you find the cause. And be courteous with incidental findings. Ask the questions, will treating this improve my life, or will it just improve the numbers? When you are giving metformin, ask the doctor, will it just reduce the blood sugar, or will it solve the problem of insulin resistance? Will it correct the diet on my table? You need to focus or begin to focus on fundamentals: real foods, regular movement, adequate sleep, stress reduction, and avoid toxins, which you especially find in ultra-processed foods, because the foods are laden with preservatives, with homogenizers, with stabilizers, with different chemicals that not only destroy your gut integrity, but will change the trajectory of your life forever. That's why you begin to seek holistic support. Ask searching questions. Look for nutritionists, physiotherapists, functional medicine clinicians, naturopaths, people who address disease without prescription of medication, people who look at the whole person as an individual and not just at the numbers. Oh, my blood glucose is this, and then they are looking at the number. No, you need somebody who will look at you holistically. Begin to build a community, because healing is not just biology, it is social. When you continue to isolate yourself, you make your disease worse. Hippocrates reminded us, he said, let food be thy medicine, and let medicine be thy food. The same thought Paracelsus said, the dose makes the poison. So even though that you might be taking small dose, over time it's accumulating. The more it accumulates, the more poisonous it's become. There's something Rudolf Virchow said. He said, medicine is a social science, and politics is nothing but medicine on a large scale. Now, these are not just dusty quotes, they are maps that we have ignored. There are two men, both are 55, both have high blood pressure. One takes his pill, eats the same way, works the same hours, sleeps 5 hours, never exercises, and he feels stable. But the other changes his food, works 30 minutes daily, reduces stress, builds a community, sleeps deeply. The same diagnosis, the same starting point. But who will win this war? It's always the one who treats the cause. My friends, lowering a number is not the same as healing a life. A pill is not a plan. When you go to the doctor and he gives you a pill, it is not a plan. Managing symptoms is not healing. So if you understand what I'm trying to share, you need to start asking root cause questions. Take one step today towards food, especially good food, towards movement, towards rest, proper rest, towards renewal. Because we cannot continue winning battles without understanding that over time we might lose the war. So the time to fight differently is now. I am Dr. David Kakaraka, and I'm always available to help you. I've made out a proposal sometime in the past. I shared my vision, and I'm going to share it in the next 1 minute. I said, my vision, if eventually I'm given the opportunity to be a minister of health, what will I do? If I am appointed minister of health, my mission, as what R.F. Kennedy is doing in America today, will be to make Nigeria healthy again by shifting our system from crisis response to prevention, to root cause healing, and to efficiency. I will restructure and I will streamline Nigeria's Ministry of Health, and I will reorganize it in such a way to reduce duplication, to cut waste, and to ensure that every kobo serves the citizens. I will merge overlapping offices, and I will create a single national agency for healthy Nigerians. And that will focus on prevention, nutrition, and public health. I have said it often and on that nutrition should be taught in schools the way we prioritize English and maths. Because a lot of English professors and mathematics professors, they die like fools without knowing that they dig their grave with their knife and with their forks. I will tackle chronic disease with over 70% of the hospital beds filled by lifestyle-related disease. I will launch a national anti-chronic disease plan, and this will target hypertension, diabetes, and cancers through food reform, awareness campaigns, and affordable preventive care. I will ensure food safety, and I will introduce a nutrition reform so that we can begin to phase out harmful additives, harmful dyes, and trans fat that are in the foods that we are eating and in the Nigerian market. I'll create policies that will encourage natural, local, and holistic sourced foods. I will now begin to get rid of ultra processed junk foods. I'll begin to discourage it, especially in schools. And I will take a look cost approach where you have to begin to look at environmental toxin, unsafe water, poor sanitation, because these things drive disease. My plan, if I ever become a minister of health, we integrate ministries of environment, agriculture, and health so that we can begin to address the root cause and not just to prescribe pills. And again, I talk about primary care first. I will try to expand and equip community health centers so that Nigerians can begin to access early, affordable care where they live. I will emphasize prevention and health education. These things will take priority over expensive emergency treatments. These things are easy to be done. I can promise you they are very easy to be done. So my offer to everyone is that it's possible to live well again. It's possible to win the battle and win the war, and not win the battle and lose the war. It's possible, but it will start with you as the patient, not just with the doctor. But I'm also talking to the doctor so that as you administer your treatment to any patient that comes, look at the patient as a person and treat the patient as a whole and not the numbers. Seller.